In this morning's STL Moms report, across the country, there is an urgent growing need for more mental and behavioral health services for children. Joining me is Dr. Nick Holekamp. He is the Chief Medical Officer at Rankin Jordan. Good morning, Doctor, and thank you so much for joining us.
Morning, John. Thanks for having me.
Say, what kind of psychology services does Rankin Jordan have for children right now?
Well, we've had an inpatient psychologist for some time, and more recently we've been able to hire an additional psychologist for the outpatient population through a very generous grant from the Centene Corporation, and really has helped us add that component of service to the care we provide to medically complex kids on the outpatient side.
Yeah, why is that so important? Tell us what the situation's like.
Well, as opposed to kids in the community who have anxiety, depression, medically complex kids who are going through intensive therapies, often after serious surgeries or accidents or additional illnesses, their particular needs require the expertise of a pediatric psychologist to really help the physical occupational speech therapists do their best for these patients.
Who are these patients, and how do they receive this service?
Well, they are outpatients referred by the community, and sometimes they're in follow-on care for inpatient stays here at Rankin Jordan after, as I said, serious illnesses or operations. And the key differentiator from the community is that these kids have these overlying complex conditions and really need often a psychologist in the therapy session with them sometimes, or need the support of the psychologist to help them deal with the therapy, which sometimes their overlying psychological conditions inhibit their ability to participate fully and derive the maximum benefit from the therapeutic encounter.
As far as age groups, are we talking, what, age 4 to 18?
Thereabouts, that's right. A typical patient is an 8-year-old child with fairly severe autism who had a big orthopedic procedure and has failed follow-on care in previous encounters because he just couldn't understand and tolerate the therapy. Our psychologist has worked directly with the physical therapist for hour-long sessions, sometimes 2 or 3 times a week, to really maximize the benefit in a situation that wouldn't happen without her being there to really help the therapist do her work.
So a good example of how it's definitely making a difference.
A big difference, yeah. And it really speaks to providing care for the whole child and the whole family, which is really what Rankin Jordan takes pride in. You can't separate the psychological and the emotional from the physical, and in the case of these kids, it's critical to their overall success and recovery.
Right. Dr. Nick Holekamp, thank you so much for joining us from Rankin Jordan this morning. We appreciate it. Continued success.
Thanks very much for having me.
All right, our pleasure.